In this session, we'll talk about regulation of nursing practice. Laws, standards of practice, and guidelines from professional organizations regulate the practice of nursing. Nurse Practice Acts are enacted by each state within the United States. The State Board of Nursing is the agency responsible for regulating nursing practice. They are charged with protecting the health, safety, and the welfare of the general public. State boards of nursing are in each state, and they are responsible for approving nursing education programs, defining the practice of professional nursing within the state, establishing criteria that allow a person to be licensed as a registered nurse or a licensed practical or a vocational nurse. They define professional practice, which determines the scope of practice or those activities that nurses are expected to perform, and by implications, those they may not perform. They develop rules and regulations for guidance to nurses, and state boards also enforce the rules that govern nursing. Licenses are issued by states, and all states require graduation from an approved nursing program and successful completion of the National Council Licensure Exam, the NCLEX. So you have to get a degree and pass the NCLEX. To receive licensure in another state, though, you would just simply apply for endorsement, and you follow the guidelines of a mutual recognition model, so a compact state. So if I wanted to get a license after graduating in the state of California, I would want to take the test in California to get that license, because that will take the least amount of time within the state. Licenses across states can take a little bit of time, but you don't have to take another test. If I don't know where I want to work after graduation and I'm in Idaho, living like maybe at my parents' house, I should just take the test and get licensed in Idaho until I figure it out, because it is easy to move once you have a license. But know that states talk, so if you have a license issue in one state, it can be found by other states. And then standards of practice are professional standards. These are established by the American Nurses Association, and they are authoritative statements of all the duties that all registered nurses, regardless of their role, the population, or the specialty, the unit that they work in, are expected to perform competently. So standards provide a guide to knowledge, skills, and attitudes that a nurse must incorporate into their practice to provide safe, quality care. Standards are used by individual nurses, employers of nurses, professional organizations, and other professions. So these would be what, if you were called to court when you're taking care of a patient, the lawyers know about the standards of practice, and they would say, did this person perform based on the standards? So you would also be called to your state board practice. So if you got called to court, you would have to understand both of those roles. We have a practice slide here for identifying who the regulator is. Is it the state board? Is it a Nurse Practice Act, which, remember, is defined by the state board? Or is it a standard of practice, so by the ANA? So laws that regulate nursing practice. Laws are made by a Nurse Practice Act at the state board level. Statements of the duties that all registered nurses are expected to competently perform would be standards of practice, which includes the 16 standards. That would be the ANA standards of practice. State specific would be the Nurse Practice Act from the state board. The state board and the Nurse Practice Act establish criteria that allow a person to be considered an RN, LPN, or an LVN. The state board would support enforcement of rules that govern nurses, and what includes the standards of care and professional performance. So that would be the Nurse Practice Act. And then know that every state is different. I posted the website for you to go. It's the National Council of State Boards of Nursing. So all the states, including Guam and Puerto Rico, have information on that website. And I wanted you to go and explore it to see what is the rule for nursing that you would be adhering to when you decide to graduate. So some states like Montana have really clear and easy to find rules. In Idaho, we like to give autonomy to individuals with degrees. And so the standards of practice in Idaho say if you've been trained to do it, you can do it. So it is nice because we have more autonomy, but it can be a little harder for a nurse to defend themselves. You would have to prove that you've been trained in a certain task or in a certain area before you could do a certain thing. So when I first started, I like rules, and so I did not like having a vague law, but I think you need to just be aware of what those rules are when you practice. And here's the thing, nobody reminds you about these rules, okay? So when you're in ICU and the doctor tells you to administer some medication into the ICP of a patient, the drain that's going into the patient's brain, over the phone, what do, right? The doctor doesn't care really what your scope of practice is. They are wanting something done for the patient, so it really is up to each individual to advocate for themselves. So some significant professional organizations. I feel like I talk about these organizations all the time. So the ANA, right? And here's the thing, I'm not advocating for one professional organization or another. I'm just trying to give you the information on them. So I don't want you to feel like I'm shoving it down your throat, but it is my duty to share with you these organizations. So like I said, the ANA is who sets the scope of practice. They set the ethics of practice. The National League for Nursing is a universal standard of education. The International Council of Nurses, they're all nursing organizations in different countries. And so they help to guide practice across borders. But also there's specialty organizations. Clinical specialties would be like the operating room nurses or oncology, Emergency Nurses Association, critical care. So each of those groups have an organization. Also, there's group identification. So there might be associate degree nursing, or there's the National Association of Hispanic Nurses, or the American Assembly for Men in Nursing. Lots of different organizations. There's also similar values. So Nurse Christian Fellowship, Nursing Ethics Network, all of those are options. Sigma Theta Tau is a National Honor Society for Nursing. So students can enter access into Sigma Theta Tau by holding a certain GPA, and then you can have that throughout your time as a nurse, your profession, I guess. And then the National Student Nurses Association is an arm of the American Nurses Association. So this is for nursing students. We currently don't have an active student club, but I would say right now you should consider joining the National Student Nurses Association. I think it's $20 a year, and there's lots of conferences. There's many leadership opportunities within that organization. Bradley Geckner is our faculty member in charge of that. So if you ever have questions, you would just go to him or come to me. I always like to talk about it too. We talked about the categories of healthcare, the types of healthcare, but really I want to make sure that you understand this clearly, because it is important to understand what level of healthcare is being provided. So primary services are delivered by a primary care provider. It is done generally in clinics or diagnostic centers. At the individual level, primary care is working with specific clients for teaching wellness. It could be a group and family teaching nutrition to a classroom. It could be at the societal level where they're establishing care standards. Secondary healthcare is historically hospital-based care, but increasingly surgery centers, offices, and outpatient centers are occurring. This would be health restoration too. Tertiary care is historically in extended care facilities, but now it could be in the home or outpatient settings. And so the type of service is going to vary dependent on the location. And here's the thing, the changes in healthcare, these are changing all the time. So you need to really determine what type of care is being administered. We already talked about where healthcare is provided, but knowing these things for the exam is important. And then how is healthcare financed? The really fabulous thing about this slide right now is that I am not going to dive into this. You have a class as an S2, or I'm sorry, yeah, I think it is S2, that is totally devoted to healthcare policy and financing, taught by somebody with a background in finance. So it's important for you to know, though, that people are paying for healthcare in many different ways. They're paying it out of pocket through private insurance or employment-based insurance. The government has Medicare and Medicaid. And my friend helped me remember which was which by saying that we care about our elderly. So that's Medicaid, or I'm sorry, Medicare. So if you're 65 or older, and then we provide aid to others. So if you're younger, you could get Medicaid. Certainly there are outliers within those things, but that was a helpful tool for me. And then charitable organizations like the Red Cross, states sometimes provide financing, lots of different ways you can pay for health care. The big thing, though, is knowing that people delay getting health care because of cost and access. So you might have the privilege of getting health care at any place at any time because you have insurance, but understanding that health care can't be obtained by all is really important. And also there's many disparities within healthcare, and so we need to recognize that. So we ensure quality care because we have accrediting bodies that inspect our healthcare organizations. These are, they do differ, but the main one you would hear of is the Joint Commission, or JCO. TJC is another one. Ensuring quality care has improved because reimbursement from the government and insurance sources is now dependent upon passing these accreditations. So places won't get reimbursement when they aren't providing safe, quality care. So if you have a wound in the hospital that you got from the hospital, the hospital won't be reimbursed for that. They have to eat that. So it helps them to provide good care. Many facilities will have a quality improvement program, and there is a model for performing that. And now we'll talk about healthcare reform, but just a little bit, because nurses are expected to lead changes in healthcare. And that was the video that I had you watch. It was about the Institute of Medicine's report that I talked to you about in week 1. So nurses really should be leading changes in healthcare because we are the largest profession. We should seek to remove scope of practice barriers so that mid-level providers can practice fully. We should advocate for those care providers. We should increase the proportion of baccalaureate nurses again. We should prepare and advance nurses to lead changes in health, and we should build an infrastructure for interprofessional workforce status. So what a physical therapist or occupational therapist or doctor knows should be known to a nurse as well, and vice versa. So if we can all share information, it would help us to provide better, more cohesive care. So healthcare reform is the process of changing the healthcare system, and we are in a significant need for healthcare reform in the United States. Um, the National Institute of Health Policy, you can use that website to look up what it is that they're working on, but really we are worried about accessibility and equality within healthcare. Also, practices and costs. We are insane in healthcare, according to Albert Einstein. And so, really focusing on how we can improve is important. The hard thing is, you think one person can't make a big change. And so you just kind of go with the flow, but really it needs to be one person in each institution that's leading healthcare change. So healthcare quality can be accessed online. The scary thing is that at Johns Hopkins, they've calculated that 250,000 deaths per year are due to medical errors. And the fast facts on the right is that 10% of all US deaths are now due to a medical error, and it's one of the highest causes of death in the United States. They're not always reported, but respiratory failure can be classified as a healthcare error, right? So we want to make sure that we're practicing safely. The projection for 2017 to 2026 is that national healthcare spending will grow about 5.5% annually. And we look at 90% of our healthcare spent is towards chronic diseases like diabetes, asthma, heart problems. We know that we can do better by providing education and kind of grassroots levels, mid-level provider services to improve patient outcomes. There's studies that show that when patients focus on their health and get involved, then health improves and expenses decrease. And so this class really is focused on the tools that you need to do these things. Accessibility is a huge issue, and we'll talk about this more. But you can look at the AHRQ and see that we are getting better in some areas. The thing that it's important, though, is knowing that these statistics come from people where care is accessed. And so if we look at the fact that care isn't being accessed by people who are in this category on the right with a different race, different ethnicity, different socioeconomic status, age, sex, disability, orientation, or identity, all of these people weren't in those facts, right? And so we are improving, but we need to make sure that we're improving at an equal level. The healthcare system, the ANA has recommended that we do a work redesign and consider healthcare differently. Is healthcare a right or a privilege? So nursing needs to understand the goals for your patient, the setting where care is provided, the most effective ways to meet a patient's need, and then barriers to care. Because we can provide solutions that overcome those issues. Societal trends that influence nursing practice. We know that the nursing profession, we're going to have a nursing shortage in the next 3 to 5 years, and COVID is not helping. There's many hospitals that aren't hiring because they don't have patients right now, and there's hospitals that can't hire enough. So we're seeing huge disparities, and nurses who don't go into practice will delay going into practice. Or not going to practice at all, even though they've been through a program. And so we're not helping the problem. The economy, consumers, legislation, and women's movement have all impacted nursing practice. And then trends we are seeing in practice. We are seeing increased use of complementary and alternative medicine, which I think is a fabulous thing. Anytime we can avoid a prescription and use something that isn't going to have the same side effects is good. We are seeing a variety of care locations like we talked about in class and interprofessional collaboration. So I'm working with other providers to do a better job at providing care on a wider level of access. Expanded career roles for nurses is something we're seeing, using more assistive personnel, and then the influence that nurses can have on health policy. We need to make sure that even though we're using high tech ways to deliver care, we're still cognizant of being a high touch profession. So it is so exciting to be in the nursing profession, and there's so much we can do within our profession. And so that's what I hope you get from this class, is just a passion for what you have the potential for within nursing. Thanks.